a great day for all, but especially for the children at Pawcatuck Middle School. And we say, well, what's a school-based health center?
Well, the school-based health centers are licensed as outpatient clinics. We are guests in the school, and we walk a fine line between collaboration and confidentiality. So we augment both the physical and the behavioral health services that the school has in place already. So there's still a school nurse, there's still a school social worker, but now through our clinics they have a clinical social worker or clinical mental health professional as well as a nurse practitioner.
Our job is to make sure the kids are healthy and ready to learn. So if a child's ill and sees the school nurse and she asks me to see them because they have a sore throat, I can evaluate that child for strep throat, and if it's positive, we can start the treatment right away, and we communicate with the family around this at the same time. And the child can come back to school after being treated in a very short manner. One of the things I think that the kids have told us at school base is they feel very grown up when they use our services. Regardless of how old they are, they feel that they're learning how to access services, they're learning to describe how they're feeling, they're identifying how they can do some self-management, whether it's how they're feeling physically or emotionally. And that's a really, really important thing that we're doing for this generation of kids, is to create that sense of ownership of their own health.
I encourage parents to sign up for the school-based health center through Child and Family when they register here at the Regional Multicultural Magnet School. I let them know that it is not to replace their pediatrician, but it's a service that we have here for them, for their children if they get sick during school hours. So what I do is I see students who come down who are ill, and then if it's something that I can't take care of, then I refer them to school-based health if they're signed up.
With our school-based health centers, we have both medical and mental health. We're a team, and we provide services for the families together. And having both sides of the house be able to help a family really broadens what we can do.
So I provide mostly individual counseling for clients, which means I have a clientele of about 25 students, and I provide weekly therapy for them. In those therapy sessions, there's an array of different things we can do. I set treatment plan goals for them, and the child and the family are both aware of what those goals are. They usually have some sort of mental health diagnosis, whether it is ranging from anxiety and depression, or perhaps a mood disorder or a trauma history. So what we do in here is we work towards those goals. So we learn different cognitive behavioral interventions, and not only do we learn them, but the child learns how to practice them and then implement them in the home or school setting.
I think, for example, of not so many years ago, one of our nurse practitioners being the first to pick up on a child's heart murmur, because that child and that family didn't happen to have yet established a really strong relationship with their community primary care provider. I think also of the child, the student who recently wrote to us letting us know that if we had not been there through a series of suicidal crises, that he would not still be here with us, growing, thriving, having a future, and everything that will come from that.
We have presently 18 school-based health centers, 17 of them that are funded by the Department of Public Health, and one of them that's funded through the United Way and our reimbursements and other agency fundraising.
So because we have these funds, every child who goes to the school has access to the school-based health center, regardless of their insurance status or finances. And I happen to have asked for a study of school-based health centers, had it right in my hand when they came up and said it's been cut from the budget. And we immediately did a press conference saying, hey, the data says that these places are amazing and that they work.